No. Okay. Welcome, everyone, and welcome back to another session. Today, we are joined with Dr. Oka, who is going to be teaching us a lot more about general dentistry. So, Dr. Oka, the floor is now yours.
How's it going, everybody? I'm Dr. Landon Oka. I'm a general dentist out in Hawaii. I'm on the island of Oahu, and I practice out of Mililani. I'm in roughly my second year of practice, so I'm just going to be sharing a couple of things here with you guys. Let's go to the next slide. Okay, so this is me. I'm from Pearl City, Hawaii. Practice in Mililani, like I said. Graduated from IU in 2019, and I got my bachelor's degree at Oregon State in biomedical science. Next one. So it's super funny because I've kind of always wanted to be a dentist from when I was like real small. So I was like 5 years old, and I'll tell my parents, "Oh, I want to be a dentist when I grow up." I also told them I wanted to be a garbage man, so there's that. So I started shadowing back probably my sophomore year of high school. That's a typo, I meant to put high school. And I started working as an assistant probably my freshman year of college. And then, so I started at Indiana in the summer of 2015. Got a lot of volunteer experience there. There's a ton of opportunity. So there's like Mission of Mercy in Indiana. We have the Student Outreach Clinic like I have on the slide. Student Outreach Clinic is a student-run organization. It's like a multidisciplinary thing. So there's law school, there's med, there's us. I think there's pharmacy, and what's the other one? I can't remember the other one, but there's all kinds of disciplines working together for one clinic, and we help homeless populations, people with no medical, no dental insurance, and we did free work, I think 2 Saturdays a month. So after I graduated from IUSD, I had to go through the whole licensing process, which took me about 2 months. So in the state of Hawaii, when you get licensed, you have to pass all of your licensing exams. You apply for your license, and the state and the state board have to approve your license in order for you to get it. So it can be really quick if you make it through the first round of approvals, or you can have to wait like 2-3 extra months, like how I did. And I lucked out getting my job. I ended up working with my dad's cousin out here, and I also part-time at a corporate office as well. We can go to the next slide. So what is general dentistry? General dentistry is exactly what it sounds like. It's it's a scope of all different kinds of things. So we see patients throughout their lifetimes. Depending on your training, you can kind of do whatever you're comfortable with. I know guys doing implants. I do root canals. I extract teeth, fillings, crowns, dentures. Most of that is with us. There's a lot of general dentists out there that also do some perio surgery, so gum surgery, bone grafting and stuff like that. So there's almost no limitation to what you do as long as you're willing to get the training. COVID makes things kind of hard to get training in right now, but some things I'm looking forward to getting more training in is, implant stuff, and then something called biomimetics, which I'll talk about later. So we can go to the next slide. So advice for college. So your major doesn't really matter. It doesn't really matter what you do as long as you hit your core classes, all the prereqs. So what I would recommend is, go and talk to your college counselors, go talk to your pre-dental club, pre-dental advisors and stuff, and, put together all the classes that you need. Find your list of schools that you want to apply to, and kind of write down what their prerequisites are. Most of them will have them listed somewhere. Make a list, make sure that you get all those classes. And if your school doesn't offer it, I would look into, maybe taking a class at a different school or something, try to get a credit for it. Number 2, develop great study habits. So that's something I struggled with personally. It started in college. So my freshman year of college, I wasn't that great, but I worked together with some of my friends and worked on my time management, worked on my study skills, and that translated a lot better when I went to dental school because compared to college, where I was taking roughly 15 credits a semester, once we got to dental school, it was upwards of like 21 to 26 credits. So it's a lot of studying, a lot of time in the lab. So it can get pretty stressful. But if you start early and develop these skills, sets you up for success in the future. Number 3, big piece of advice here, enjoy your time in undergrad. You're not going to get it back. You can only pretty much do it once unless you really want to go back to school. So I really encourage you, go out, have fun. If your school's got sports, watch them. Make a lot of friends, join a lot of study groups, stay out of trouble. Last thing you want is something on your legal record, but enjoy your time because it's only going to come once. You don't want to just spend your good years indoors studying the whole time. Next one. Okay, so typical day for me, my first job, that would be in private practice. So it's me and my uncle out there. So we start around 8 a.m., see about 3 to 5 patients in the morning. He sees a little more because we kind of count the hygiene checks as, seeing a patient as well. So lunch starts around 1 to 2, and we see another 3 to 5 patients depending. 1 day a week, which would be for me yesterday, we go from 8 to 7. So that's our kind of long day. We have a little extended hours to kind of accommodate for more people. So for me, because I'm working on my own, I'm an independent contractor, which means I'm pretty much like my own business within my uncle's business. I'm kind of just renting out the chair. So I'll do everything from the cleanings and exams to extractions, root canals, doing crowns, everything. And I do that all on my own. I don't have an assistant or anything out there. So everything, I do it on my own. I do the CAD CAM stuff as well. We have a scanner and a mill in our office, and I'll show that later. My second job is at a corporate office. So we start at roughly the same time, around 8 a.m. Thursdays, we start at 9. So I see a little more there, a couple more patients because I am doing hygiene checks. I also have an assistant out there, so it makes things a lot easier. We take lunch roughly 12 to 1, and then we see another 5 to 10 to end around 5. So pretty much everything is the same, except we don't have the CEREC scanner or anything. So we're doing traditional, take an impression of the teeth and everything. But like I said, I have an assistant out there, makes it go a lot quicker. I'm not having to fumble around and do things on my own. And I don't have to do the cleanings, which I appreciate because we have hygienists at that office. So we can go to the next one. Let's see. So what kind of complaints do patients present with? So when you're in general dentistry, the complaints can vary pretty wide. So I've had patients come in and say, hey, I think this tooth is loose. And that can mean anything from, it's just moderately loose. So typical range that's normal is about movement of 1 millimeter either way. That's okay. But sometimes, the tooth is like, you look at it and if you blow a little too hard, the tooth's going to fly out. So that's what we see with that. We also have people say, oh, my teeth are yellow. I wish I could whiten my teeth. Do you guys whiten teeth? I don't like how crooked my teeth are. The big one here, I'm sure a lot of the pre-dental students out here already know, Smile Direct Club. That's become a big thorn in our side in the dental community. The American Academy of Orthodontics I think they filed a lawsuit last year against Smile Direct Club. So we'll see how that goes. But for the most part, I try to steer people away from doing that and try to get them to see an actual orthodontist. They get more comprehensive help and, it's just better. There's more interaction with the doctor. And, if something's going wrong, they can always correct it instead of, here's a computer, like, look at your stuff. Another complaint. I think I broke this tooth. So that's one that can range a lot too. So it can be anything from a small chip to a little rough edge on their tooth to completely breaking off the top of a tooth or cracking off a cusp tip on one of the molars or premolars or something like that. And then the last one, this tooth hurts a lot. That one also varies. People have different pain tolerances and it's very tough to kind of gauge where they're at just by talking to them. When you take a look with x-rays and you look in the mouth, it makes it a lot more clear, kind of what they're going through. So it can be anything from fractured teeth, which can cause a lot of pain, to infections. Infections will cause a lot of pain. And then a really common one that they'll report pain or sensitivity is just gum recession, which can be from orthodontics, so braces, or brushing too hard. Next slide. What kind of procedures do general dentists perform? So it really, like I said earlier, it really depends on who the doctor is. So it can range from a person that just wants to do crowns and fillings. I know there's some doctors out there that do only fillings. Most of those guys are really old and they're kind of just working their way out, but it can range from fillings and crowns to doing implants, supported dentures, which is a pretty invasive procedure, really involved, pretty tough to do, a lot of training. But like I said, you can do anything as long as you're willing to go through the training for it. Big question is, should you try to do everything? I think it's fine for now, if you're interested in something, to go get training for it, but you got to know your limits. And, that's where a lot of people run into legal trouble, is when you don't understand your limits and, where you need to punt per se and refer out to a specialist. That's where things get a little iffy. So just knowing your limits and knowing what you can do is pretty much like the real important thing to develop. A lot of people take these trainings just to see how far they can go on their own and where they would need to refer. So biomimetic dentistry, so advanced adhesion, is something that's kind of taking over the restorative community right now. So biomimetics, what it is trying to restore teeth to their original form using restorative materials. So it relies a lot on bonding to the tooth structure instead of just sticking something on there and making retention. Traditional dentistry, traditional crowns and fillings rely a lot on retentive form, so making troughs, undercuts to hold things on. Biomimetics is a lot of relying on adhering to the tooth. So you can make a flat tabletop thing and stick your restoration on there and it'll stay really nicely. We can go to the next slide. Okay, so new technology in general dentistry. So like I mentioned earlier, the CAD/CAM crowns, that's a huge one. So CAD/CAM crowns is basically computer-aided design and computer-aided milling. And what that is we have these scanners. So 3D scanner is the next point. You take the scanner, you scan your crown prep, you scan your prep, whatever, and it will develop a computer-aided design of your crown. And then if you look on the right, it's that picture on the right with a little wand. Yep, right there. So that is the scanner. The mill is right below that. And with the mill, you can mill out different kinds of materials. So I've seen people do composite material, different types of ceramic, zirconia. You can even do metal. So one of the labs I refer to actually does milled gold, which is really nice. Yeah, so that's super cool. It really incorporates, new technology into our field. Digital x-rays, not super new, but not every office has them. Some people still go with the traditional phosphor plates or the film x-rays. The film x-ray, the difference between the digital and the film picks up a little bit more of the details. The downside with that is that you can't blow it up and enlarge the image, so it makes it a little harder to see. Digital x-rays are really convenient. You take it and it's immediately on your computer and you can assess it. Digital charting is something that offices are starting to implement now as well. It's a lot better than handwriting. So I actually handwrite my notes at both offices that I work at. We use traditional charting. So it's it's a little bit of a hassle, but it's all good for now. I'm just kind of working. So another thing that we use is a CBCT scan, so cone beam computed tomography scan. So you can do a low volume, which can do like a section of your face or jaw, or you can do a full volume, which is your full head neck area. With the CBCT scan, you're able to see the density of the bone, pretty much any hard material. So bone, teeth, Sometimes if there's like a clotted artery or something, it'll show up on the imaging. The main thing that we use them for is to assess the bone density. So if you look in the bottom left, that's my next point, is the XNav computer guided implant. So that kind of goes hand in hand with the CBCT. So what it does is it uploads your CT scan into the XNav software. And basically there's all these different markings on the XNav handpiece, and it's almost like a computer game. It puts you in the correct alignment to put your implant in the bone in the most dense area. So it's super cool, real new stuff. I got to see it at Chicago Midwinter. And then one of the dentists that I know out here, he uses it and he loves it, but super cool, fairly new implant stuff. So I'm actually looking into getting training for that. And then the last point, we got Dr. Evil down the middle, the lasers. So lasers are something that are starting to be implemented a lot now as well. Most of it is for soft tissue contouring. So the periodontist, the gum specialist, will use this a lot. You can do frenectomy, so cutting the frenums of the lip and tongue with that. You can do certain procedures as far as perio. So one of the doctors out here will use it to do his cleanings, his deep cleanings, and it helps to regenerate the periodontal ligaments, the ligament around the tooth. There's also lasers that people use to prep teeth and remove caries or cavities. But you know, I haven't seen too much of that, but it's out there. It exists. From what I hear, it works pretty well. So we'll see how it goes. We go to the next slide. Let's see. So important terms in general dentistry. So I kind of broke it down super simple. So some important terms are types of teeth. Super important. If you're a dentist, you really want to know what the teeth are. So your molars, standard tooth. We got one on the top, or I guess the whole right side, far right. So that's your molar. Incisors are the ones up front. Premolars are between the front teeth and the molars, so our little bicuspid guys. And the canines are the ones that are commonly called eye teeth. They're also called a cuspid because they have a single point. And then wisdom teeth, or third molars, are the ones that are the most commonly extracted. Types of restorative materials are also pretty important terms. So old school filling, amalgam, there's the silver color fillings, composite and glass ionomers. Those are two tooth colored fillings. So the composite is usually a light cured material, tooth colored, and you go through a full bonding protocol for those. Glass ionomer is often a dual cure or chemical cure material. It's a lot easier to place those, but it's a lot messier, and they don't finish as nice as composites do. Gold is gold. Zirconia is a type of metal that looks like a tooth. And you know it's zirconia because when you cut a zirconia crown, sparks are going to fly. Ceramic is another important restorative material as well. It looks like a tooth, acts like a tooth. So usually that's what I've been using for my crowns and stuff. And then we got tooth surfaces. So this is the part that gets a little confusing because there's a lot of different terms for a lot of the same sides. So try to keep up. I know it's super confusing, but so we'll start on the top. So buccal. Buccal is in referred to your cheek. The main muscle of the cheek is called the buccinator. I think the Latin term is bucco, which means cheek as well. But it can also be used interchangeably with the next term, facial, which is just the face side, so it faces the outside. So buccal is typically what you use on your posterior teeth, so the back teeth, molars, premolars, and then facial is what you use for your front teeth, so your incisors and canines. Palatal is on the palate side, super simple. Lingual is the tongue. Those can also be interchangeable, except you can't use palatal on the bottom teeth. I spelled occlusal incorrectly, so it's actually OCCLUSAL. which is the chewing surface of the posterior teeth only. So your molars and your premolars. And then incisal is the cutting edge, so your anterior teeth only. And then we're going to go to the next point, which is mesial. Mesial means closer to the front of the face. Distal means closer to the back or away from you. Apical is toward the roots, so toward the apex of the tooth. Gingival is toward the gums, and interproximal is between the teeth. So where the teeth touch together where you're supposed to floss. Next slide, please. Okay, so we're into our cases here. So this is case number 1. This was a 21-year-old female, pretty standard, pretty healthy. She just had a history of, not taking care of her teeth, but she's doing a lot better. You'll notice looking at the picture, she's got pretty much no plaque buildup. So she's been in pretty good shape since we started seeing her. When she came and saw me for the first time, she had a lot of decay. A lot of these cavities were a lot bigger. So these are teeth 29 and 30. So this is the bottom right. So I positioned it so it's like you're looking at the patient and they're opening their mouth. So we have occlusal and buccal caries on tooth number 31, which is the molar. And then just occlusal decay on number 29. So those are on the chewing surfaces and the cheek side. So pretty much what I do is, I forgot a pre-op picture on this one, but I take out the decay. You kind of just run around with your burr, take it out until it's nice and solid. And I restored these with composite using biomimetic technique, which essentially is, it's more about establishing the bond with the dentin, which is the inner surface or the inner structure of the tooth within the enamel. We can go to the next slide. So this is the final restoration. I like this one because the picture turned out really nice. So I've been working on my photography skills. It's not great. I think the purple really helps with the lighting, makes it look really nice. But yeah, so the final restoration, this is after it's been polished and everything. But the contours, what I try to do is I try to restore everything to how it was before. So I try to replicate the structures, the grooves, everything that was there. That way when I take off the rubber dam, so the rubber dam is a purple thing in there over the tooth. And the thing around the molar is called a rubber dam clamp. And what that does is it provides isolation. I like it because it keeps the patient's cheek and tongue away from the teeth while I'm working. It also creates a better bond for your restorative materials. Prevents saliva from getting on there and contaminating your surfaces and stuff. And it also helps pictures turn out really nice, apparently. So I try to restore these contours, keeping in mind that I want my bonds with my material to the tooth surface to form at max strength. So I really try to keep everything clean as well. So we can go to the next one. So this was an interesting case, case number 2. So 65-year-old female, same thing, very healthy. She had really good oral hygiene. I think when she was younger, she said she had some problems with her hygiene. She kind of had to start paying for a lot of dental work, so she started taking a lot better care. So you'll see this upper right molar. So this is tooth number 3. So upper right, you'll see on the occlusal surface, a lot of damage here. There's an old restoration. All that brown stuff on the inside of that occlusal area is decay. And she had a lot of wear on this tooth. So I don't have a very close-up picture, but in the close-up picture, there's fractures in the tooth and all things pointing to doing some kind of indirect restoration, so a crown or something like that. So this is kind of where I implement digital dentistry. So this is at my uncle's office. So I used a CEREC in this case, and I decided to go with an overlay, which is very similar to a crown. Overlays, we bill them as crowns because it's a full coverage of the occlusal surface, but there's no real reduction on the cheek or palate side. So we can go to the next slide. Okay, So this is the picture on the right is where I prep the tooth. So you'll see I don't take away almost anything on the cheek or the palate side. I take away enough to give my material the proper thickness so that it's strong enough to resist fractures. And then I'll take away on the occlusal surface to give it some clearance. And then the interproximal area, the in between the tooth area, I'll clear that out so I get enough material in there as well. And I can control the contact points in the interproximal. So we can go to the next picture. So here's a really bad picture, super blurry. But what you can see in this picture is on the tooth that I prepped, it's nice and smooth. I tried to take away any sharp corners or edges on the prep area. And that goes with our biomimetic concepts. What we want to do is put the smoothest piece of porcelain onto this tooth with as little corners and edges on the inside of the crown portion. So when the mill goes, there's a burr in the mill, which helps to cut out the inside of the crown and the rest of the crown. They can only be so exact. So the smoother you make it, the easier it is for the burr on the mill to get this crown milled out for you. So we can go to the next slide. So here's the process. So on the left there, we have a scan of a prep. That's not the one from the picture, but that's what the scans will show up as in the computer. The color is, it shows the thickness of the material. So the lighter the color, the thicker the material. So that one I should have probably prepped a little bit more on that. I think that's the palatal side, but that one ended up being okay. The middle image is the crown being milled out there. So on each of those two arms on the side, there's a little burr attached to it. And the purple thing in the middle is the crown being milled out. So with the CEREC, if you're milling a Emax, which is what this material is, Emax is a type of porcelain. And what this is it's a purple block. It comes purple, and then you throw it in an oven and it turns into the tooth color restoration on the right. So it causes it to go through a phase change to change the crystal structure of the material. And it shows up as this nice tooth colored crown thing. We can go to the next one. Still, my rubber dam tore in this picture. It's all good. It was still isolated. So this is when we were ready to cement the overlay on the tooth. So if you look in the picture on the left, the white thing that's covering the very last molar, that is Teflon tape, also called PTFE. We put it in there when we were bonding our crowns on to prevent the cement from sticking to the tooth behind there. If you guys get any experience working at an office, the last thing you want is for your cement to stick on the tooth behind there, because then you're in for a long appointment trying to clear that out and open that contact again. So I put that in there so I get a nice adaptation of the crown and the cement, and I'm able to clear off the excess pretty easily. The picture on the right is when it's fully seated and cemented on there. I like the shade match on there. I think it matches the ones in front. The only thing I wish I did was, recommend that this patient do a little bit of bleaching, because the final tooth structure it's still got some of the staining from the old restoration that was there. And then some of that, I don't know what she drinks, but it caused a lot of staining on her teeth. Let's go to the next slide. Yeah, so this is our starting point on the left here and our finish point on the right. And this patient was real happy with how it turned out. So we save a lot of tooth structure when we repair teeth like this. So let's go to the next slide. I think we have one more case. Oh yeah, this case is real nice. So this case, I wrote nothing down about it. I totally forgot. This is just a bonus. So we're going to talk about this. So this patient has gastroesophageal reflux disease, otherwise known as GERD or acid reflux. So he's been dealing with that for a while. So you'll see I didn't take a pre-op picture of this, which I'm disappointed in, but the molar behind there is really worn down, but all of his teeth are kind of shelled out and worn down. So with GERD, you see a lot of implications in dentistry because it causes the enamel to thin out, and teeth will kind of wear down a lot faster. So you'll see pitting of the surface, which you can kind of see on the molar on the bottom left there, kind of see it. And then you'll see a lot of wear, which you can see in the picture on the right on that molar as well. So he had pretty advanced lesions on his teeth. And I think before I got to the office, we tried to do crowns for him before, but the insurance didn't want to cover it because they thought it was more of an aesthetic issue. So I took a bunch of pictures, sent them the x-rays, and told them, like, you know, it's a matter of like this guy being able to keep his teeth or not. So after we sent in that report, they approved it, and we were able to do these crowns for him. So I put 2 rubber dam clamps on these teeth. So there's one on the molar and one on the premolar. The reason for that is to get better isolation. So these teeth have already been prepped. You see it's like a nice smooth dome-shaped surface. Real simple, just replacing the occlusal surface of these teeth. So we'll go to the next slide. Yeah, so this is the top view. The reason why it looks like a matte finish on these teeth is because I did something called immediate dentin sealing. So essentially with biomimetics, what you want to do is prepare the dentin, so the inner tooth structure, prepare it so that you can bond to it. So what I do in this case is I'll rough up the tooth surface with air abrasion. So air abrasion is basically sandblasting with smaller particles. Then we apply our bonding resin, and then we put a little resin coat over. And when we're ready to deliver, I air abrade again, and it turns out like this picture here. So we have a nice smooth matte finish on it, and it's ready for bonding. So we'll go to the next picture here. And this is our final cemented product. The image on the left should have been a lot better. Came out really, really blurry, so I'm not super proud of it, but the picture on the right is what it looks like in the patient's mouth. I liked how it turned out. The bite was really good. If you look real closely on the bottom right in the corner, you can see the opposite side of his arch, where the teeth are kind of really worn down there. And that's how he kind of initially came in. So after we do his right side, we're going to hop over into his left side next and fix those teeth as well. So, you know, I like this last case because it really shows what we can do in practice. We can really change someone's health around. And this guy, when he initially came in, was really kind of felt like he couldn't do anything about his teeth. He couldn't fix it or make them nicer. And, you know, after talking with him and putting these first couple crowns in, you see a complete shift in his mentality. And that's one of the things that I really love about dentistry is, you know, you can really impact someone in a positive way. So that to me is like a huge thing. It's what keeps me going. And it's what got me into this profession in the first place, is being able to help other people. So I got a couple more cases like this going on now. I've been trying to photo document more. If you're interested, I have Instagram and all that. I don't know if I put it on here, but I'm sure if you follow the Instagram page, the Dental Shadows Instagram page, my information is on there as well. I think that's the last of my stuff. I think. Yeah. Okay. So last page is the advice. So advice to future dentists. So you guys can read along with me. Committing yourself to the dental field is a really big decision. It's a lot of time, like tons of time. You know, it's not just classroom and studying, but you also have to get shadowing hours. And, you know, I highly recommend getting a lot of volunteer hours as well. It's a very, very, very big financial investment as well. Myself, I'm in over $160,000 in loans. We'll put it there and won't talk about that anymore. But it's a lot of hard work and dedication as well. It's a lot of putting time in your free time, especially once you get into school. I was in the lab at school every week on average about 8 hours. So it's a lot of work outside of the classroom as well. It's not something you want to kind of just go in halfway and, see how you like it and, think that you can just back out at any time. It's a really big commitment. Most schools, the first year is about, I think the average now is probably around 80,000, maybe higher. But so it's a big investment just to kind of like futz around with, but not really something you want to kind of go halfway in with. But it's like I was saying earlier, it's also an absolutely amazing profession in the medical field, super unique, a lot of variety in what you can do in one field, and you can help put a smile on someone's face and make a powerful and positive change in their life. Super awesome. I think that's it. Yep. Oh, I did have it in there. Cool.
Awesome.
Yeah, thank you so much, Dr. Oka, for the wonderful presentation. And right there, social media is right there for Dr. Oka. So if you guys want to follow his Instagram, maybe look at his future cases that he'll post up. And so, Dr. Oka, I'm going to take a few questions from our chat, if that's all right.
Cool.
So our first question we got is, what made you choose Indiana University?
So being from Hawaii, a lot of the guys around here, the older guys, there are a lot of IU grads. So I decided to apply out there just for that fact. Kind of like banking that they'll see a guy from Hawaii and be like, oh, we've had guys from there before. And he's got a good background and, they'll consider me there. So how it went down is I got 6 interviews, I think. I got University of Washington, which was my first choice, USC, Detroit Mercy, Roseman, IU, and University of New England. Here we go. That's the 6th one. So I had 6 interviews. IU was my first one. I actually got waitlisted everywhere that I applied to. And so I was like feeling super discouraged, but IU gave me a call and they said they had a spot open up. And I actually liked the school when I interviewed there. I thought it was a pretty good setup. The students had nothing but good things to say. A lot has changed since I went there, but my time there was pretty great. But yeah, kind of the reason why I picked it was because they're the first ones to give me a spot.
That's a good reason.
Yeah.
All right, so the second question we have is, what made you choose general dentistry as opposed to specializing?
So that's actually still something I'm considering. That's the cool thing about dentistry is once you get started, you can kind of go back for certain specialties, and if you want, you can reapply. So I'm still considering going back to school for endodontics, which is specializing in root canals and root end surgeries. But I like general dentistry because, there's a lot of patient interaction. So you continually see the same people. So you develop relationships, you get to know them a lot better. And you get to see their family. And during the holidays, it's kind of like the best time because they'll always come in and they're always happy to see you because most of the time they're just in to get their teeth cleaned. So for me, those patient relationships are super awesome. Being from Hawaii, we have like a pretty strong influence of family, like a sense of family. So that to me, as a general dentist, like being able to form that with my patients is super important too. So I think that's super cool. And then also, I kind of geek out over the biomimetic stuff like bonding and, doing all these restorations. So that's fun.
And do you think COVID will have a long-term impact on dentistry?
See, that's a good question. I'm glad someone asked that. I think it won't have that much of an effect on dentistry. I think dentistry is one of the fields where PPE is used the most. We're constantly using masks and gloves and face protection, eye protection. So adding a couple things on there, probably like a lab coat or something like that. Most dentists already do that, but doing like a disposable gown or something like that, it's not too much to add on. And with the suction and everything, especially having an assistant there, it keeps the aerosols pretty low. And then they've got these extra oral suction things that almost eliminates most of the aerosols. So I don't think it'll affect it too much. And I think that's what they're kind of discovering. I think the transmission rates to dentists is less than 1%. Might be a little bit more. I'm not too sure now, but last thing I saw was 1% or so.
So another question we have is, how did you become a dental assistant in college? Also, how did you balance it with school?
So the office I started shadowing at when I was in high school actually hired me on as an assistant. When I was shadowing there, I was already helping around the office. So I'd help to like do the weird stuff. So I'd like fix the vacuums. I helped change out light fixtures and stuff. And so I saw everything that the assistants did. And in Hawaii, you don't have to be registered and you don't have to go to school to become an assistant. You just need to get trained by the office. So that's what they did essentially during my shadowing time, is they trained me to be an assistant. And then when I got into college, they started paying me. How I balanced it was I only worked on my breaks. So that was cool. So I'd go home and work and over like summer break and winter break and stuff. And then while I was in school, I didn't have a job in school till my senior year, but that was working at a coffee shop. So not too bad.
Do you prefer working in a corporate practice or a private practice?
Oh, that's tough to say. There's perks of both. For private practice, I liked being able to do it my way. I like, not having to be on someone else's clock. And I think once I'm able to hire an assistant, it'll be a lot better too. The corporate office I work at has actually been pretty great. When I signed on, they needed a dentist. So they told me, however you want to do it, man, like do it your way. We just need someone in here. So it's been really nice. And I know a lot of people have really bad experiences working at corporate dental offices, but so far for me, I think it's location specific, but they've been really nice to me. And they take care. So the question was, which do I prefer?
Yes.
Yeah, I think I still prefer private practice just because, it feels like we're less about profit and we're more about taking care of the patient. Because at the end of the day, the corporate office is going to run the numbers and they're going to want more production. So, yeah, that's kind of my take on it.
Makes sense. How did you avoid burnout during dental school?
A lot of different things. So, a lot of it was downtown Indianapolis has a lot going on as far as sports, and I'm a huge sports fan. So we would go watch the Pacers play. We'd watch the Colts when they were in town. There's the Indianapolis, I think it's the Indians, but I think it's a 3A baseball team or 2A. So pretty good, like semi-pro baseball. There's like Indy 500, lots going on sports-wise. And then kind of the main thing I did was I went to the gym a lot, played basketball, lift weights, run. And I also bought a bike, so we would go biking a lot as well. And then being in Indiana, you're kind of in the middle of everything. So it's not too far. Well, it's not really a ridiculous drive to go to places like Chicago, Cincinnati, Louisville. So we would do that sometimes too. So that's good to kind of just like get a reset and get your mind ready to go back to school.
What is your opinion on AEGD/GPR residencies, and do you think they're worth it?
Ooh, good question. So my opinion is, certain states like New York will require you to do a year of residency, whether it's a GPR or AEGD. AEGD programs are more if you're trying to be just a regular general dentist. So my friends that do it, or my friends that have done it, essentially they're just running like a dental office with someone overseeing it. The GPR programs are going to be more your hospital programs, so hospital dentistry. So a lot of times you're going to be working on trauma patients. So like someone say they broke their tooth or they've got this mad like infection in their tooth, or a setting where the patient is sedated or something like that. So that's kind of the big difference. If you're trying to get into more of the like extractions and stuff, GPR is probably the way to go. More the surgical side. Also, if you're trying to get into sedation dentistry or public health will also look at GPRs a lot more, I think, from what my friends have told me. They like that experience because you've been working in like a hospital for the most part. The AEGD program is more of a thing to kind of get your hand skills up, get your speed up on your procedures like fillings and stuff. So either one, it's like when you get to school, you can kind of assess where you're at and where you want to go and, pick from there. What I like about dentistry too is like you don't have to do a residency. So I didn't do one. I just came straight home and started working.
Mm-hmm. And on that note, did you feel ready to go right into practice after graduation?
For the most part, I did. When I started off, I was a little bit slower than I wanted to be. But you pick it up real quick. So I'm probably like twice as fast as I was when I started off. I think for me, the thing that made me feel more prepared was when I was in school, I would actually try to do things more efficiently and do things better so that I can prepare myself to go out and practice. I would also, like my faculty at school, I told them like what my goals were. And a lot of them were, that's what I loved about Indiana was like the faculty were like, dude, yeah, I like what you're doing, so I'm going to help you out. Like they really try to push you to do better. And, when you do a bad job, they're like, dude, you did a bad job. This is what you did. I know you're going to make it better. But having those relationships with the faculty is kind of what helped me to get myself to a point where I'm like, all right, cool. Yeah, I think I'm comfortable enough to like go out and do this or, be on my own somewhere.
So this question is about dental school debt. How do you manage to pay back dental school loans, and any advice about how to lower student debt?
Okay, so how do I manage to pay it off? So working a lot helps. So I work about 5 days a week. I know a lot of dentists that do like 3 or 4, but those guys have already probably paid off their debts and they're just cruising now and enjoying life. But so for me, 5 days a week, I really try to not miss work days. I try not to take off too much time because I know it's going to take away from what I'm going to be able to pay. I have my rate payback at a 10-year rate. So my loan payments are a little higher than most people. But I figured for me, that's kind of the window that I want to pay it off in. So it's, it works out pretty well. As far as lowering your loans, there are some things that you can do. Forget what the programs are called, but there is some loan forgiveness programs where you work in underserved areas. I know he's on social media, but my homie, Stephen Liu, is in a program where he works. I think he's working at a dental clinic, and I think it's like a low income area. So it's like a government run facility, and he works out of there. And I think he has to do it for a year or 2, and they forgive most of his loans. So that's one really good option too. I think there's also programs through Indian reservations where you work a couple of years out there and they just forgive everything for you. So, the opportunities to have a more affordable dental education is out there. You just got to kind of look for it.
It's very good to know. When did you start clinical training in dental school?
Clinical training kind of starts in your second year. I know OHSU and a bunch of other schools will kind of put you up there doing cleanings and stuff your second year. But for us, we were kind of up there our second year. They let you do certain fillings and stuff. But you have to be supervised by a 4th-year student on the clinical faculty at the same time. So it's a little more of a hassle for the patient. Actually, after first year is when we do our stab lab. So we learn how to do injections and whatnot on each other. We do impressions and learn how to place rubber dams. So that's kind of like your intro. So kind of first year actually. But you don't really start doing anything real until second year, and then third year you're full on like up in clinic, and then fourth year it's like almost all clinic experience.
So now we have a few questions about your third case. So how long did the procedure for the GERD patient take?
So when I do crowns on the CEREC, I typically block it out for about 2.5 hours. For a lot of people, that beats waiting 2 weeks for your crown to come back in. So the prep for that was actually really quick. Most of the tooth was already kind of worn down and eroded away. So the prepping probably only took me like 5 minutes. The scan took about another 5 minutes or so. The thing that takes a little bit longer is the immediate dentin sealing portion. So with the air abrasion, so the sandblasting of the tooth, applying the bonding resin and applying my my layer of flowable resin over that, it does take a little bit longer. So that takes I give myself like 10 minutes to do all that, working by myself. What that does is it just gives you a better surface to bond your final restoration to. The milling process for one crown takes about 15 minutes. So 15 minutes per crown, so about half an hour for the milling. And then I threw them in the oven together. So that took about, I want to say another 15 minutes there, and then 5 to cool off. So that's about 45 minutes to prepare the crowns. And then I'd say it's about 25 to 30 minutes for cementation. So I have to, with the ceramic crowns, you have to do a process called silination. So I air braid that too. So I sandblast the inside, apply the silane. Silane, what it does is it creates a hydrophilic, easier layer to bond to with your resin. And so you want to apply that to the crown first, otherwise you're going to have problems with the crowns popping off. So that part takes about 2 minutes. So I air dry that with some heat. And then the bonding and cementing of the crown itself takes about 5 minutes. Yeah, so overall,
Thank you for that breakdown.
Yeah, no problem. Yeah, so it's roughly, I give myself 2.5 hours because afterwards too, you're gonna have to play around with the bite on the crowns as well, just to get it in the right spot.
And does the acid reflux eventually wear on the crowns?
So it won't wear the crowns, it'll wear the tooth structure. So with that patient, what I had him do is discuss with his primary care provider what the problem is, what's going on. So he's going in to see his doc, I think this month. So I told him when he goes in, have his physician give me a call and I can talk over kind of what's going on. I think the movement now with medicine is more of this holistic care. So communication between the different fields. So like your physician's going to talk to your dentist a lot more, your chiropractor and stuff like that. So we can communicate and get on the same page with everything going on with the patient. Then we can provide better comprehensive care for the patient in the end.
And now we have a few like pre-dental related questions. So someone wants to know, how many shadowing hours do you recommend to be a competitive applicant for dental school?
So I had like a crazy amount. I actually went to some interviews and they're like, can you verify this number? I'm like, oh yeah. So I think what's the minimum on that? Like, is it 100 hours minimum?
I think it depends on every school, but like a lot of them say they recommend 100.
Yeah. So that's kind of like your minimum. You always want to try to shoot for more than the minimum requirement. So, doubling that would be nice, but I know that's not super easy for everybody to do. I think what else stood out on my application was it wasn't just shadowing at a general dentist office. So the dentist I was shadowing actually had me go to every different specialty and shadow there at least a day. So I shadowed with orthodontists, periodontists, endodontists, and oral surgeons. There's another couple specialties, so pedo and pros. Prosthodontists is like denture guys, like the prostheses, and then the pedo is like kids. And then there's also dental public health and radiology. So I didn't do those ones. I did like the kind of big five right there. But I think that stood out because not too many people go out and shadow all these guys. That could also be something that will help your application stick out.
And do you have any advice about writing personal statements?
My advice for personal statements, I actually did like another IG page actually had me do a little quick write-up about it. But I think the biggest advice that I can give is really try to show them who you are and not just try to think, oh, what do they want to see? What do they want to hear? Like, you know, show them who you are and why you actually want to be in dental school. And I think that shows a lot to them, who you are, and helps them make a better, like an easier decision.
Mm-hmm. All right, and our last question, what was the hardest thing you faced and had to overcome as a dentist?
Oh, hardest thing you have to face. So I guess for me, one thing that I had to kind of get comfortable with is, you know, not everybody's going to be happy with the treatment they're receiving. Not everybody's going to they're not going to realize like what you're doing is probably like the best thing for that situation. And, you know, most people don't fully understand, you know, where their pain or discomfort is coming from, what can be happening to cause that pain or whatever. And, you know, when a patient is in pain, they're not going to be thinking the most rationally. They're going to want to get out of pain and that's it. So, you know, I think the hardest thing for me was just getting comfortable with the fact that, you know, at the end of the day, they're not always like, not every single person is going to be happy with, you know, what you did. But I've had patients that like when they leave, they're kind of pissed, and then they come back their next appointment. They're like, you know, I realized what you did. And, you know, once I was out of pain, I was able to think, and, you know, I appreciate that you took the time to do what would be better long-term for me than just fixing the immediate problem. So, you know, having that mindset of like, you know, in this situation, am I doing the best thing for them? And like, you know, having, especially like if you work with an associate or a partner or something like that, like when you discuss it and, you know, all the other options weren't as good, coming to terms with that, what's probably the best thing is not always what the patient's going to want to hear. And I think that's the hardest thing, is just getting used to that.
Mm-hmm. Well, I think that's all the time we have today for questions. Thank you so much, Dr. Oka, for answering all of our questions.
Not a problem. Thank you for having me.
Thank you so much, Dr. Oka, for taking the time to be here with us and for preparing this presentation. It was very interesting to learn about your cases.
Thank you. Thank you for letting me share. If you guys have any questions, feel free to reach out to me on social media. I pretty much always respond to all my IG messages, so feel free to hit me up there with any questions or anything you want to know more about.
If you guys want to see more of Dr. Oka's cases, his Instagram handle is right here. And thank you guys so much for joining us. Thank you again, Dr. Oka, for being here with us. Make sure you guys tune in tomorrow for our next session, which is going to be at 6 p.m. EST. We hope you all have a great